fully detailed, expanded explanation of hydroxocobalamin, including deeper pharmacology, clinical use context, nursing considerations, and safety notes. Number 1. Generic name, drug class, brand name. Generic name, hydroxocobalamin. Drug class, water-soluble vitamin, vitamin B12 analog, hematinic agent, cyanide antidote when used in high-dose IV. Brand names, injection, US, cyanocit for cyanide poisoning, injection, UK, EU, Canada, neositamin, hydroxocobalamin injection, BP. Other generics, simply labeled hydroxocobalamin injection. Definition. Hydroxocobalamin is a crystalline injectable form of vitamin B12 that contains cobalt. It is more protein-bound and longer lasting in the body than cyanocobalamin. It plays a crucial role in hematopoiesis, production of red blood cells, DNA synthesis, neurological function, maintenance of myelin sheath, detoxification of cyanide. 3. Mechanism of action. Hydroxocobalamin works through two main pathways depending on its use. A as vitamin B12 replacement, converted in the body to methylcobalamin and adenosylcobalamin, active coenzyme forms. Methylcobalamin acts as a cofactor for methionine synthase, converts homocysteine to methionine, required for DNA synthesis and myelin maintenance. Adenosylcobalamin is a cofactor for methylmalonyl-CoA mutase, important for fatty acid metabolism and energy production. B. As cyanide antidote, hydroxocobalamin binds cyanide ions to form cyanocobalamin, which is non-toxic and excreted in urine. This reaction directly removes cyanide from mitochondrial cytochrome oxidase, restoring oxidative phosphorylation. Number 4 uses primary vitamin replacement in pernicious anemia, dietary B12 deficiency, e.g. vegans, elderly, malabsorption syndromes, e.g. celiac, postgastrectomy, congenital enzyme deficiencies affecting B12 metabolism, cyanide poisoning antidote, first line in many countries, adjunctive therapy in tobacco amblyopia and optic neuropathy. Number 5, indications. Documented vitamin B12 deficiency via serum levels, methylmalonic acid, homocysteine, pernicious anemia, autoimmune destruction of intrinsic factor-producing cells, megaloblastic anemia caused by B12 deficiency, cyanide poisoning, smoke inhalation, industrial exposure, lab accidents, congenital methylmalonic acidemia, some forms, optic nerve atrophy due to B12 deficiency. Number 6, contraindications, known hypersensitivity to hydroxocobalamin or cobalt. Early Leber's hereditary optic neuropathy can worsen optic nerve damage. Use with caution in severe polycythemia can increase RBC mass, severe hypertension, antidote doses may raise BP further. Number 7, before taking this medicine, precautions. Disclose history of allergies to cobalt or vitamin B12 formulations. Inform if you have kidney disease, drug and byproducts are renally excreted, iron or folate deficiency, correct these as well, otherwise anemia may persist. Pregnancy or breastfeeding, generally safe, high doses only if benefits outweigh risks. High-dose cyanide antidote treatment can turn skin and urine red for days. May interfere with certain lab tests, bilirubin, creatinine, iron studies. How to use. Vitamin B12 deficiency, given intramuscularly IM, deep injection into deltoid or gluteal muscle. Cyanide poisoning, given intravenously, IV via dedicated line to prevent drug interactions. Administer slowly to reduce injection discomfort. For chronic therapy, lifelong treatment may be required in pernicious anemia. Number 9, dosing information. A vitamin B12 deficiency pernicious anemia. Initial, 1 milligrams IM every 2 to 3 days for 2 weeks or until symptoms improve. Maintenance, 1 milligrams IM every 2 to 3 months, lifelong if intrinsic factor deficiency. B. Cyanide poisoning. Adults, 5-gram IV infusion over 15 minutes. Second dose of 5 grams may be given depending on severity. Children, 70 milligrams kilogram IV over 15 minutes. Max 5 grams per dose. Number 10. Missed dose and overdose. Missed dose. Take as soon as remembered unless it's close to the next scheduled dose. Do not double dose. Overdose. Rare in deficiency treatment, but high antidote doses may cause severe hypertension, rash, headache, nausea, kidney dysfunction. Number 11. Stop or avoid taking. If you develop a severe allergic reaction, hives, breathing difficulty, swelling. Vision changes worsen if you have Leber's hereditary optic neuropathy. You develop unexplained high blood pressure after treatment. Number 12. Side effects common. Injection site pain, redness, diarrhea, mild nausea, headache, skin redness or flushing, red-orange urine, harmless. Serious, allergic reactions, anaphylaxis, severe acneiform rash, high blood pressure, especially in high-dose IV use, visual disturbances, rare. Number 13, vital information. Storage. Keep it 20 to 25 degrees Celsius away from light. Protect from freezing. Lifelong therapy is often needed in pernicious anemia. Do not stop abruptly without medical advice. May temporarily alter lab values. Inform lab personnel if tested soon after dose. Keep in mind, skin and urine discoloration after antidote use is normal. Ned 14. Other drugs that will affect hydroxocobalamin, chloramphenicol, antagonizes hematopoietic response to B12. High-dose vitamin C degrades B12 if taken simultaneously, separate by 1 hour. Alcohol, chronic use, reduces B12 absorption. Folic acid can mask hematologic symptoms of B12 deficiency while allowing neurological damage to progress. Nitrous oxide, repeated use, inactivates B12 and can precipitate deficiency despite supplementation. Thank you. Have a nice day.